Over the last 24 hours, we have identified 1,646 new cases of COVID-19 and completed about 17,200 tests. Our positivity rate currently stands at 9.5%. We have identified 1,020 additional cases of variants of concern in the last 24 hours. Variants currently represent about 54% of our active cases. There are now active alerts or outbreaks in 478 schools, which represent 20% of all schools in the province. Yesterday, Alberta Education moved grades 7 to 12 to online learning in all Calgary schools. To complement this decision, effective Monday, all extracurricular youth, sport, recreational, and performance activities within the City of Calgary will be required to either take place outdoors or be paused during this same 2-week period. We know this may be disruptive to families. However, by shifting these activities outdoors, they can continue in a lower risk setting. We will update the website and alert stakeholders of this change as soon as possible. As I've said before, we are seeing a sharp rise in cases among younger Albertans in this third wave, along with all other age groups. While the change to move older students online in Calgary was an operational decision, I support it. The best thing we can all do to reduce cases in schools and all other settings is to stop this virus from spreading in our communities. There are now 416 people in hospital being treated for COVID-19, including 86 in the ICU. We have now administered more than 1 million doses of vaccine in the province. I am also pleased to announce that Alberta Health Services will soon implement a program to immunize eligible long-stay patients in acute care facilities across the province. Patients who are eligible will be able to receive their COVID-19 immunization on-site while in hospital if they wish. Eligibility will be based on a variety of factors, including the provincial rollout plan, length of stay in acute care, and the patient's medical condition. We expect this program to be available at all acute care sites across the province within the next few weeks. Sadly, 5 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the family and friends of those who have passed away. Right now, the vaccine is available to anyone in Alberta between the ages of 55 and 64. You can book an appointment at participating pharmacies across the province or online with Alberta Health Services. I am also pleased to announce that walk-in vaccinations are available at 26 participating pharmacies in Calgary and Edmonton. AHS will also open 2 walk-in AstraZeneca vaccine clinics on Saturday in Calgary and Edmonton. While these walk-in locations are limited to Calgary and Edmonton, you don't need to live there to get your dose. Anyone in the 55 to 64 age group, regardless of where they live, can walk into these locations and receive their vaccine, or find a participating pharmacy nearby to make an appointment. I think we've seen people who have a lot of questions. I've certainly heard a lot of questions about the vaccines being new products and wanting to understand how they've been tested, what kinds of processes we have in place to monitor their safety. Lots of questions about how they work. That's part of the reason why my team and I have been working to set up stakeholder meetings where I can directly have conversations with different key stakeholder groups to answer those really key questions about vaccines, what the differences are, what the similarities are, again, what the benefits, what some of the risks are. And so I think, honestly, the majority of the questions I've heard have been, again, very reasonable questions, people wanting accurate information, wanting to understand how they what they should expect after getting a vaccine. With respect to the AstraZeneca versus Pfizer and Moderna, clearly the information that's been released with respect to this rare risk of blood clots has changed people's willingness to get AstraZeneca vaccine in the last few weeks. And so we have seen a reduction in the number of people. If we're looking at the willingness of people to receive different vaccines, that has gone down with AstraZeneca. But again, if we were not transparent, if we did not disclose this information, we would be doing Albertans a disservice. And so again, our intention is not to twist people's arms, not to coerce people, but simply to be transparent, to offer the information and to offer them that choice of protection, especially now that we have a better understanding of the magnitude of the risks of this particular syndrome and the kinds of things that can be done to very quickly identify and treat it should it occur. I think what I would say, independent of whatever decisions are made in the coming days and weeks about what additional restrictions may be in place, that it's very clear that our numbers are rising, our hospitalizations are rising, our ICU admissions are rising. It's having an impact on, for example, our ability to continue to offer in-person learning in some places, such as Calgary, and that all of us have a role to play in preventing transmission by reducing the number of in-person interactions that we have with people outside our household. And so while the multiple considerations around restrictions are worked through, again, that doesn't preclude us from taking action in the things that we do every day to stop transmission and to bring our numbers down.